So we will discuss mechanism of action of opioids. So supraspinal is it acts on a rostroventral region of the medulla and inhibits the nociceptive signal. Then at the spinal level, it acts on substantia gelatinosa of the dorsal horn. Then at cellular level, it acts on G protein receptor and increase potassium in channel and decrease calcium, therefore decrease excitation. We will discuss pharmacodynamics of opioids. With the prototype drug as morphine. First we will discuss cardiovascular system. Causes hypotension. It is due to release of histamine, then decreased sympathetic tone, and vagal induced bradycardia. Minimum hypotension is seen with fentanyl, and all other drugs, all opioid drugs cause bradycardia except pethidine and pentazocine. And one more thing is that baroreceptor reflex reserved with the use of opiates. The effects on respiratory system: decrease respiration, both tidal volume and frequency, therefore can cause hypoxia and hypercapnia, and this is the cause of death in morphine poisoning. Decrease airway and tracheal reflexes. And one interesting fact is that recurrence of this respiratory depression can be there, as this is stomach and we have induced opiates in IV. It gets accumulated in stomach and then reabsorbed, therefore recurrence of respiratory depression can be there. ENS, on EEG, it causes high amplitude waves. It causes analgesia, visceral better than somatic. Action is both supraspinal and spinal. At higher doses may cause sedation, can cause mood altering and mental clouding. It decreases O2 consumption, increases intracranial tension. Therefore, opiates are morphine is contraindicated in head injury. Can stimulate CTZ and therefore can cause nausea and vomiting, and can complicate into convulsions. So some other effects of opioids. On eye it causes meiosis, but to remember is that it is centrally acting locally. On muscles it causes rigidity of muscles. Therefore, rigid muscles cause wooden chest syndrome when the thoracic muscles are contracted. There is decreased FRC, wooden chest syndrome. It causes hypothermia. And one thing about wooden chest syndrome is you treat it by muscle relaxants, succinylcholine or other neuromuscular blockers. Renal, due to hypotension, it decreases GFR, therefore decreases urine output. And on other hand, on urinary bladder, it relaxes it and therefore retention. Fentanyl has minimum effect on GFR. Fentanyl. On GIT, decreased GI mobility for constipation. And in GIT, in biliary tract, it causes contraction of sphincter of Oddi, therefore increases the pressure in gallbladder. Now, dependency is seen both physical and psychological, and tolerance is seen with all pharmacological actions except meiosis and constipation. Dose of morphine is about 0.1 to 0.2 milligram per kg. Metabolism is by liver and also kidney. 30% of the morphine is plasma protein bind. Watching this video.